Good morning, everyone. My name is Pat Deeney of Health Action Training, and you're very welcome this morning to this information session on health action training and the possibility of some of your staff doing the graduate certificate in health action training and a range of short courses. So what we're going to do is we're going to introduce yourself, and then we're going to look at some of the elements of health action training, what it involves, and the types of courses we have. And really, we want you to actually use the chat box effectively to have any questions. Our colleagues in nursing now are there monitoring what's going on to the chat box. They're also actually putting in some links to questionnaires and links to forms and so forth. So keep an eye on that. So without further ado, I'll go ahead. So it's good morning from Northern Ireland, and my name is Pat Deeney. As I said, I'm the CEO of Health Action Training. My background is in nurse education. I've been a nurse educator for some 30 years, mostly working in the field of simulation, and particularly preparation of people for crisis situations such as disaster zones and so forth, and humanitarian workers. And this involves both health professionals and believe it or not, journalists as well. And about 9-10 years ago, I had the pleasure of actually meeting my colleague, Dr. Matt Jennings. At that stage, we were working at Ulster University. And I came to Matt with a problem in relation to anxiety over role play. Nurses were experiencing quite a lot of stress and concern about participating in role play. And also, we had this issue around our curriculum where we wanted to actually implement a framework known as person-centered practice or person-centered nursing. And part of that actually was a concept known as sympathetic presence, which really challenged us as a group of teachers. And that's where we moved towards the idea of actually taking ideas from actor training. And I'll explain that in a moment. So, as I say, my name is Pat Deeney, and Sue, do you want to introduce yourself? You're muted there.
Sorry, my dog was barking. Hi, everyone. My name is Sue Foster. It's lovely to meet you all today. My background is a nurse. I have been nursing for around 30 plus years now. Mainly, my career focused in on palliative and end-of-life care. I held various clinical specialist roles within that field and then moved into education and as a lecturer in palliative and end-of-life care. I suppose my key subject areas would be advanced communication skills alongside loss, grief, bereavement, symptom management, and so forth. Joined Health Action Training a couple of years ago now. Simulation as a method of teaching was nothing new as such, with the use of role play and so forth. But what I have learned since coming on with Health Action Training is the application of the drama and the performing actors training in order to enhance that learning. So that's been new for me. And I hope today we'll share with you about our courses and about what we do, and look forward hopefully in the future to seeing some of you. So thank you.
Okay, Sue, thank you. And we've got Sharon here as well.
Hi everyone, my name's Sharon Fox, and I'm a nurse as well. I'm adult trained. Pat was actually my lecturer in the University of Ulster, and I'm qualified 17 years. My background is emergency care. I worked as a staff nurse and a sister in A&E departments, and then I moved into primary care where I was a practice nurse and a nurse practitioner. And I have come on to Health Action Training. I've done Train the Trainer, and I'm now facilitating the courses alongside Pat and Sue.
Okay, thank you very much, Sharon. And just to say, Sharon actually has completed all of our our graduate certificate and our Train the Trainer system as well. So she holds an advanced diploma in health action training facilitation, which actually is the ultimate goal for some of your staff, I think. And I'm delighted I'm joined actually by the man himself, Dr. Matt Jennings. Matt, do you want to just do a quick introduction there?
All right, sorry I'm late, everybody. Yes, I'm Matt Jennings. I'm originally from Australia, but I'm based here in Northern Ireland, where Matt and Sue and Sharon are all natives. And I was trained as an actor in the early 90s in Sydney and worked as an actor there. But when I came to Northern Ireland in the late 90s, I found myself working in the area of what they call applied drama. And applied drama is where you use drama techniques to try to improve relations within or between communities, to help people address social or political problems, to express themselves, to develop their confidence and communication skills, to create new relationships, to help to bolster people's health and well-being. Increasingly, there's an understanding that participation in drama can help to, well, among other things, according to Bessel van der Kolk, it's very effective at processing trauma and so on. So I started to work in that field of applied drama facilitation. You know, you might do drama with people with disabilities, older people, children, and so on. And I did people with mental health issues. I did a PhD thesis on community drama in Northern Ireland since the Good Friday Agreement. So there was a civil conflict in Northern Ireland up until 1998, and then I was looking at the work that community drama had done to contribute to peace building in Northern Ireland since then. That's where I've been working, and that's what I did as my research project, and completed that in 2010, and then started working at Edgehill University in England, and then Northumbria University, where I was working with social work students and lecturers, as well as nursing students and lecturers, and then eventually came back to working in Derry, where I met Pat at Ulster University, and we started working together initially because Pat's students were doing role play for assessment. They had to pass a role play assessment in order to be registered as a nurse, and most of the students weren't happy about this. They didn't like the idea. They found role play simulation stressful. And if you look at the research internationally, that's very often the case. And also they struggled to take it seriously and play it well. Ulster University didn't have standardized patient actors, so you didn't have actors hired in to play patient. The nurses were playing patients opposite each other, and they were just not believing in the truth of the situation that they were supposed to be presenting. And they would say, what's the point of this? It's not like real life. So anyway, I was brought in to come and do some sort of workshops with those nursing students to try and help them become more confident and more capable of performing their roles in the role play. And as we've gone along, Pat and I kind of discovered that there's a lot you can do with applied drama, educational drama being one subset of applied drama. So the work of people like Dorothy Heathcote on learning through drama, on learning about a subject through drama, as well as Augusto Boal on addressing issues through drama. We discovered that there was a lot you could teach people about person-centered nursing, and particularly person-centered nursing skills and processes such as sympathetic presence, which, if you haven't heard of, sympathetic presence is an alternative to empathy described in the person-centered nursing framework by McCants and McCormick as an alternative to empathy, because in nursing, empathy, absolute empathy, as in, you know, actually living someone else's experience or even feeling something similar, is not possible nor desirable. If your patient is in pain, they don't want you to be in pain, and you couldn't be in the same pain they're in anyway. So sympathetic presence is about being able to pay attention to what's happening right now, how people feel, what they want, what they need, and being aware of and acknowledging the difference between how they feel and how you feel, which is part of actor training. That's what they train you to do, to pay attention to yourself and to others, and to be clear on the difference between what you feel, what you need, and what they feel and need. So we got very excited about it, and about 4 years ago now, the very lovely Burdett Trust funded us with a grant to work with nurses in the local NHS region of Western Trust in Northern Ireland, and we worked with about quite a lot of nurses, over 100 nurses, and we had some amazing results. We delivered these 36-hour graduate certificates, and people who were struggling, and we ended up doing it all on Zoom because of obvious reasons. And people who were really struggling, nurses who were really struggling with their burnout, some had already burnt out, some were on the verge of it, were coming back from the burnout during the course. And we had resilience scores increasing from, by a minimum of 10 to 15% in each course, up to 28, 30%. In fact, the last course we did with nurses in Northern Ireland, 38% increase in resilience scores. Or as Carl pointed out, we had some nurses who were in the severe depression zone of resilience scores, whose resilience went up to by 38%, well above the average for the ordinary population. And person-centered communication skills have been increasingly, have been dramatically improved. Again, we use a questionnaire-based psychology tool, the person-centered practice index, and minimums improvements of 10 to 15% in every single case. So for the last 3 years, well, not the last 3 years, for the next 3 years, starting maybe 3 months ago, we've been working with Nursing Now, again, with the wonderful beneficence of the Burdett Trust Foundation, who seem to be pretty impressed by the results we had in Northern Ireland. So they're happy to let us work with nurses internationally. And we've just finished the first 2 graduate certificate courses, where I have to say the results were even more pleasing and impressive than we expected after the Northern Irish ones.
Okay, so we're going to come back.
Story in one go.
We'll come back to those elements actually, but just to pick up what Matt said there about the Burdett Trust. These courses are funded, so that means that they're free at the point of delivery. But obviously, you will have to allocate your staff time. Time is absolutely critical. We'll talk about that in detail later, and we're hoping that you can facilitate that. So maybe, Matt, if we just use the slide, because some people might find it easier to sort of follow the written work. Do we just summarize again what exactly is health action training?
Yeah, so health action training, I mean, I mentioned applied drama earlier. So applied drama would be like drama you might do in a primary school with children, helping them to learn facts or ideas or key principles or concepts through play. Or, as I said, building confidence and communication skills, or raising and addressing social issues with, usually with non-professional participants and so on. And applied drama has this approach of inclusivity, of advocacy. So it's about people coming together to identify issues and then speak up on their behalf. Everybody's welcome, all abilities and all backgrounds can work together, etc. So that's a particular ethos, and it's also games-based. So applied drama is about learning through having fun, experiential learning, dialogical pedagogy like Paulo Freire, people learning and sharing, and teachers learn and learners teaching each other. Actor training is an entirely different kettle of fish, where people are trained to be the sort of best performer they can be in a very competitive industry of the theater and film industries. But actor training teaches you techniques to make you more effective in performance. And applied drama might teach you some techniques to make you more effective in a performance, but it's mainly about the people working together in order to have fun and challenge and transform their societies and themselves for the better. So one of the advantages I had, having trained as an actor in Australia and then working in applied drama in Northern Ireland, I could draw on techniques that I'd learned in actor training to make the applied drama more focused, which very few people actually do, which might be surprising if you're not from a drama background. But applied drama, actor training, and role play are 3 very separate areas three very, very different professions, and almost no academic research on the area of corporate role play. A lot on actor training done by different people and separate from applied drama. So we've combined the three. We work with nurses who may have done role play before, and we give them actor training tips to give them a clear idea of what they might want to do with their situation in a scenario, and how to improve their performance, the performance in the professional role of being a nurse. And we do it with that applied drama sense of inclusivity, of fun, of raising social issues, of, there's no such thing as a mistake, because every potential idea is, a new version of reality. So we combine simple but powerful actor training techniques with that applied drama approach to address situations that nurses are encountering in work through role play. So we take a situation that the people who are in the workshop have been dealing with. We give them active techniques in order to improve how they approach it, such as actions and objectives, which was the real clincher and the breakthrough for the nursing students when I first was working with Pat. Actions and objectives made sense to people. Simply means identifying what it is that you want to happen next and what you're going to do to other people to get it. And also in actor training, I might focus on what I want. I want to rob the bank, and I might threaten people to get it, but I wouldn't care too much about what other people's objectives are. They might want to stay alive, not be killed by the bank robber. But with nursing, not only do I want to be clear on what I want you to get back into bed, I want you to take your medication and so on, but also I need to be clear on what the other person wants. Maybe they want to go home. Maybe they want a drink of water. So we clarify actions and objectives. We play with them through drama games from applied drama with this ethos of addressing our everyday life and working together collaboratively, and use the role play to specifically address specific problems having in their workplace, either with patients or family members or with team members and management, and support each other in trying new ways and rehearsing for transformation, as Augusto Boal says, rehearsing for change and positive change. As I say, we've developing this workshop plans over years and years and years. It's very similar to the work that I've done with children and adults with learning disabilities, as well as with professional actors, as well as cross-community groups and so on. So you can apply the techniques to any circumstance, to any situation, whether it's breaking bad news to a patient or a family member, or to exploring the difficulties with managing a business. So especially team building, team relationships, leadership roles, it's been extremely effective in helping people. We've been lucky that almost all of the, I think in fact probably all of the courses we've run have included nurses from high levels of directorship at university or even within local health organizations, to early career nurses working together, and everywhere in between, people, nurses and midwives together, people from pediatric nursing, people from oncology, et cetera, emergency nurses, management, and developing their understanding of each other's roles as well as their own. And that's where it's been really helpful.
Okay, thank you very much, Matt. Maybe if we move now to just Sue will take us through just an overview of our short courses.
So your microphone's off. Step one in the communication skills training.
My dog's doing a lot of barking in the background, so I'm forgetting that I have it on. Anyhow, folks, I want to share with you now some information around the short courses. And here at Health Action Training, as well as our graduate certificate, which is a 36-hour course, and Pat is going to chat about in the next slide. I want to share some information with you regarding what we refer to as a short course. Each of these courses is 12 hours in duration. They take place the same day each week for a 3-hour session over the 4-week period. Now, the 3 courses that we have on offer, as you can see, is Coping with Crisis, Wellbeing and Growth. And very much in this course, we are exploring, and confidence in dealing with the crisis, finding your own voice, and looking, as Matt had already referred to, the idea of sympathetic presence, key performance skills and so forth, self-care and well-being. Followed on from that, our second short course is leadership, communication, leadership and team working. Again, exploring the whole idea of cultural leadership, person-centered practice, team working and relationship management. And lastly, coping with role play for simulation and assessment. Again, looking at the whole idea of the health action training, workshop planning, organization delivery, and really all 3 focusing on the key principles of person-centered practice and reflection throughout. Now, each of them are 12 hours long, as I say. Each of those completed, you would then result on being awarded a graduate certificate in health action training. The last course, Coping with Role Play for Simulation and Assessment, has an assessment to that, a formative assessment, a summative assessment to it. The other 2, the first course and the second course, are informal assessment throughout. So in order to complete all 3, the first 2 courses must be done in order to complete the role play for simulation. Now, this is a lot of information, obviously I'm sharing, and I don't want to confuse anyone. And most certainly at the end of the session, we can, open for questions and so forth. And most certainly afterwards, if anyone has any queries or any information that they need relating to them, most certainly to get in touch and I can share that with them. I suppose I want to highlight when it comes to the courses, as Pat has already related to, these all health action training is funded by the Burdett Trust and the Nursing Now Challenge. So these are free for you and your employees, obviously, to participate in. They are accredited, okay, with the Royal College of Nursing and the CPD Standards Office. And they also work towards your continuous professional development hours. Here in Northern Ireland, we have the Nursing and Midwifery Council, and of course, those CPDRs from undertaking these courses will go towards our revalidation for our Nursing and Midwifery Council. I also want to say that the way it is set up is, if you look at the actual application form to register for a course, you will have a choice of undertaking the short course or undertaking the graduate certificate, which Pat is going to refer to. What I will say is just pick one or the other. Just pick one at this stage. There's 2 dates will be an offer. As it's already been referred to, this is a 3-year project. We're working with Burdett and Nursing Challenge, so there will be more courses coming along the way, but at this particular time we would like you to focus in on the next 2 courses that are coming up, which is a graduate certificate on the 27th of June, and then the Coping with Communication, Leadership and Team Working on the 21st of July. So hopefully I've shared information.
Just want to clarify. Sorry if you've already said this. So you can do the 12-hour courses on their own. You don't have to do them all together to get a graduate certificate. So you could just do Coping with Crisis or just do Coping with Communication, Leadership and Team Working. And if you like it, great. And if you don't have the time or you don't see the need to do any more, that can be it. If you do Coping with Communication, Leadership and Team Working and like it, you can do Coping with Crisis as well, which has a slightly different focus on well-being. And then if you've done both of them and you think you want to finish off to get the graduate certificate, you can do the 3rd. But you can do each of those 12-hour courses, apart from the role play for simulation assessment, which is just an assessment of people who've done the previous 2 courses. But you can do coping with crisis or coping with communication on their own.
Yeah. Thank you, Matt, for clarifying that, if it didn't make that clear. So thank you. I'm going to hand you over to Pat, and he'll chat a little about the Grant Cert.
Okay, thank you, Sue. Yeah, so you can actually do it, you can build up towards a graduate certificate using the short course pathway as Sue and Matt have outlined. But really, you should think also about doing the graduate certificate as a total course, and that runs across a 35-hour period. And we say 6 days there. In actual fact, it really is across 12 days. Not 12 total days, 12 afternoons, 12 mornings, 12 evenings, 12 3-hour periods to give you the 36-hour course. And this results in a graduate certificate in health action training, which is a postgraduate qualification. And as Sue has already outlined, it's accredited by the Royal College of Nursing and the CPD Standards Office of the UK. And it really is focusing on the same ideas as are introduced in the short courses. But the real value of this course is that you're actually with a group throughout the full period, throughout the full 12 weeks, 12 3-hour sessions. And that group learning is really important as well, particularly in the arena of using Zoom. But this course is about same ideas again: centering, person-centered practice, knowing yourself, and sympathetic presence is an important process that we emphasize. And we teach people the skill of this. This is really important because this was something that we, in the early days at the university that I worked at, we struggled with. It's something, the idea was very revolutionary in a way, because it was like not empathy, but sympathetic presence. And we know now that the evidence is beginning to show that this is a very effective way of actually facilitating the therapy of nursing. But really, it's not just about the interaction with the patient and the families. It's really about creating a person-centered culture, beyond relationships with your colleagues, relationships with your bosses, and changing the culture in the organization is very important. And this makes this course very relevant to the Nursing Now Challenge, very, very relevant.
Yeah.
But we emphasize sort of like difficult situations, difficult challenging circumstances, even crisis situations, and helping people to actually play with that, reframe it, develop sort of skills in a safe environment. And relationship understanding and management of different audiences is quite important, because I think you'll all accept that the nurse is all healthcare professionals are performing in the public domain, so they must need help and support with that. And the really good thing is that when we do the assessment, this course is assessed by a group role play. That's actually where you have a small group of usually about 3 or 4 participants come together, and we give them ideas, but they design their own role play and they present it. And that lasts about 20 minutes, which is actually far beyond, I would say, any course in the past that uses role play. A 20-minute role play of 3 phases, which is actually highly dramatic and very, very good for deep learning. And it's also good then for reflective learning, because everyone that's involved in the course then has an opportunity to actually view that role play. These role plays are presented in the presence of the other participants on the course, which in itself is actually quite a big challenge. But to date, we found that participants actually almost are up to the challenge. Well, we're not surprised, because nurses are well accustomed to actually dealing with crisis situations. But it's fantastic they're able to do this. And then we follow it on with what's known as a viva voce, which is a form of assessment that we took from the applied arts, and really it's actually much more novel to say, but equally as effective as a reflective essay. So staff actually like the idea of actually speaking about what they've learned on the course, and that's actually again a small group assessment. So that's if you do this graduate certificate, that puts you in a position then to do what is referred to as 2 further courses and become a trainer in health action training. And it's our vision that we would create up to 5 or 6 hubs across the world, and we've already started on that process. And the first step is to complete this graduate certificate, and then move towards what's referred to as the train the trainer courses, and that those details are made available to people, when they're doing the graduate certificate. And if anyone needs more information, this can be facilitated by Nursing Now as well. So that leads nicely now to, I think, the next slide, Sue.
Well, I was going to say, Pat, you're raising the very important points that when we started working with nursing students and when we continue working with nurses now, a lot of people struggle to remember, let alone make sense of or find relevance or value in the key concepts and terminologies of person-centered practice or person-centered nursing. It was a vague idea of being nice and paying attention. But what we've got is people learning and saying in all of the feedback that it's the first time they've understood key terms. And whether you call it sympathetic presence or whether you call it empathy, how to improve soft communication skills. Often people are sort of expected to improve their communication skills, but nobody gives them the tools to learn how. So by doing really simple and fun activities that, as I said, I've done with children and adults with learning disabilities, people are learning to center themselves, then pay attention to what's going on inside and outside of themselves, and then focus their intention in their communication. And in that, it's unique. No one else in the world has ever done this before. And also, you mentioned the importance of having a group through the whole 36-hour graduate certificate. Yes, one of the advantages of that is that the people doing the course become a support network for each other because they've shared so much of their everyday nursing experience as well as learning from the course. And also, just to point out, somebody might have come across a Viva before, because it's often, or if not, I think almost always required as part of a PhD examination. The Viva we do is not like a PhD Viva, so you're not being interrogated by a panel one-on-one who are trying to, point out all the flaws in your argument. It's a group Viva where it's like a reflective discussion where the people who've done the role play together talk about what they've learned in a way that is friendly and supportive.
And have an opportunity to practice that as well. On the course, you practice both the role play and you practice with our help and supervision and support. Yes. So that people get the best out of the occasion. So just to emphasize there, like 12, those are 12 3-hour sessions. 12 3-hour sessions that lead to about 35, 36 hours, and that's the basis then that you would use then if you wanted to become a trainer, that you would require to do 2 further courses. So you can see there, like, Sue, do you want to maybe just pull it all together there? You have the short courses, you can build up. You can build up towards a graduate certificate. You can do them on their own. But the critical thing is that if you are building it up to take a graduate certificate, that you have to do obviously the 2 short courses, and then you must. This is really critical. To do the 3rd short course, you have to have done the other 2 short courses. So this is like this confirms that you've achieved the learning equivalent to a graduate certificate. And it means that then you can, just as I explained earlier, you can move on then to train the trainer courses. So then if we think of the short course approach, then you have straight into the graduate certificate, and we work in 3-hour sessions via Zoom. They're free at the point of delivery. They're funded by Burdett Trust, supported by and facilitated by the Nursing Now Challenge. And it's a 3-year project. Our ultimate goal is to set up international hubs where we'll actually be delivering health action training, probably in different languages. And we'll maybe talk about that as we move on to the discussion. But we're going to move now to actually look at the whole idea of, what the evaluations tell us. And Matt mentioned at the beginning that we use, before and after courses, we use international really recognized or validated tools such as the Connor-Davidson scale. And you can see here, Sharon, maybe if you want to just take us through what's on the slide, but I want you to actually talk about, your own experiences actually coming in as an advanced nurse practitioner and somebody who works in emergency care and how it was valuable to you. And now you're a health action trainer. So that's really quite important.
Sorry, just to interrupt for a second there again. Sorry, Pat and Sharon. Just because I noticed the question in the Q&A about, I think we've addressed it a couple of times, but there's still a sort of a question about the length of the sessions. So the reason why it says a 6-day course on the graduate certificate is because initially we would do 2 3-hour sessions per day. So we'd do a morning session and afternoon, particularly when we're doing it locally and in person. So the sessions are 3 hours per day. For all the Nursing Now courses, we're doing 3 hours a week. So a 36-hour course is 3 hours a week over 12 weeks. And a short 12-hour course is 3 hours a week over 4 weeks, just to clarify for that question.
Yeah, it's very important to emphasize that, that the 3 hour, we found that the 3 hour block is really, very effective, and it doesn't result in any sort of, issues around people being on Zoom for too long and all of these things. So like we have experience of actually always doing it in 3 hour units.
Yeah.
So as Sue said, don't sign up for 2 courses at once. Do one at a time.
Yes, I forgot about that. Yeah, thank you
if
for
you've got lots of
reminding me.
time on your hands, 2 3-hour a week courses.
And folks, I'll have to apologize because it's actually my confusion. I was to change that slide to 12 by 3 hour sessions instead of leaving it at the 6 days. So apologies. I just realized I hadn't did that. So
no, not to worry, but it clarifies, it affirms that, we operate in 3 hour units. That's really what the value of that is, So Sharon, if you want to talk about just about evaluation, we don't need to labor the whole point about the scores, like the scores actually speak for themselves, but you might want to refer to them, but really, as I said, it's your own kind of personal experience is really what we have. It's 20 minutes to 11, so we have now about, we want to leave room for questions, so you have about no more than 2 or 3 minutes, I would say.
No problem. So I've already introduced myself and my background, and I started with health action training doing a course in telecommunication, and I took a lot more away from it than telecommunication skills. When we look at the Connor-Davidson resilience scale there, you can see obviously the increase in the percentages of resilience scores. This is the first course that I have ever attended that looked to me as a person and how I was doing as me myself. As Matt and Pat and Sue have discussed there, we talk about centering. Through health action training, they teach you how to ground yourself, how to center, breathe and exercises. And these are practices I had never ever done before. And I soon learned that by practicing these, that I found a calmness in myself and learned the importance of actually looking after myself. Because it is so stressful and the work demand is very heavy on us at the minute, and it's adding to pressure on us. So these skills have been invaluable to me because I soon realized that by grounding myself and being centered, I was more present in myself, more present towards the person that was in need of your care or persons, and I was more attentive. So therefore I was more present. So it's no surprise that there's such an increase in resilience scores, but it's not to be resilient. It's not seen as being resilient for your profession. It's being seen as caring for yourself, and that therefore results in you becoming more resilient. Person-centered practice, as you can see, there's an increase there in person-centered scores as well. I always would have thought of myself as being a holistic practitioner, but truly, since I have done health action training, I realized that I really did not grasp the true understanding of what it is to be person-centered. Health action training delivers training in a way that strips it back to the actual simplicity of the person. How is that person? What is that person communicating to you? And you start to look at that person as a whole. And it's through the applied drama by doing the likes of Forum Theatre with Matt, and that I had never done any drama before at all. I was quite nervous about doing it, but everybody in health action training is very, very good. They're very caring, they're very welcoming, and you become very accustomed to it very quickly. But I found that I come away with learning that sympathetic presence is so much more than just being present. I've learned that through, theory, the theory side of it, I understand, but I never really looked at how I actually practice it. And this is what health action training will give you. And you take this away with you into your practice. I have anyway. And they're very simple skills, as Matt has said. They're, it's very simple, the techniques in which they use, but they're very, very powerful and very relatable to your practice. So that has been fascinating to me. And when they say about the learning experience, that 96% agree that it's been a positive learning experience, definitely has been for me. Hence the fact that I went on to become a trainer, because I have seen the impact in myself from health action training, but I've also seen the impact of what I have learned from health action training in my practice as well. And it has definitely had a more positive effect on my work. I feel that I have more value in myself. I'm a lot calmer, and I'm definitely more present to the person that needs my care, and therefore I'm more receptive and responsive to what they need. So therefore I feel like I am more resilient, and feel that I'm more skilled to go out into the workforce. So I strongly would advise anyone to come and enroll for the health action training. And it's fun. It's really, really enjoyable as well. So the more it does it, the better.
Thank you, Sharon.
Very much, Sharon.
No problem.
I think so. I think it's just the references now, and then we could maybe open for kind of questions or. Those references are actually very important because they're links to the chapters that explain these ideas in more depth. And you can, I think if you click on the link, I think you get there too.
Yep, they're both open. free to download from those links.
Yeah.
The ideas behind it, and also some of the outcomes from the development of the technique over the years.
Oh.
We are fielding questions now. Does anyone have any questions? Or did they put them in the Q&A box?
I think they may, yeah. So if you do have any questions or queries, if you place your questions now in the Q&A box or the chat box, that's at the bottom of your screen, we'll answer those questions.
Any questions at all?
Here we have yeah, that's thank you very much from our colleagues in Nursing Now there, just reminding us that you can put your questions in.
Pat, would you mind if I kind of explained the Viva a bit more as well? Because
yeah, why not? Why not, Sharon? Yeah, and I'll keep an eye on the chat box. Sure, you talk away about the Viva, yeah.
It's from a nursing point of view. It was definitely never a type of an assessment I had ever done as a nurse. And just to put it really, really simply, you're allocated into a group. And in your group, you come together, and what you're doing is discussing the theory of what you have learned through health action training, be that applied drama, person-centered practice. So it's literally a group discussion. And that is really what the Viva is. You're just expressing what you have learned from theory and person-centered practice and how that has impacted on your practice. So just to cut it back simply, it's a discussion of what you've learned, because I'd never done a Viva before either.
Yeah. But I think I would have used reflective writing as a method to actually capture that quite a lot. And it's my view that this is just as effective, if not better. Because the learning seems to, do you think so? It seems to stick, Sue. It seems to really help people to consolidate.
Yeah. I mean, when you hear the word Viva, I know for a lot of people, and some will refer to it as an oral examination. And I particularly don't like that either.
No.
For me, it's a reflective discussion. It's quite informal to a sense, and it is a very relaxed atmosphere. We're all there to support and learn from each other, and it's purely a reflective discussion. So yeah.
Perhaps we can
And the whole
ask-
process of health action training is reflective in its entirety. Even, you know, throughout the facilitation, when you're doing role plays, you come back as a group and you discuss, and within the group, you automatically start to reflect. So it is a very reflective process, and throughout the weeks. So it's not something new when it does come to the stage when you do have to do your Viva. It's something that's practiced in its entirety throughout all the weeks of health action training.
Yeah, it's something that employers, and I'm generalizing here, but sometimes employers are concerned about, sending people on courses and not getting anything out of it, that it doesn't do anything for the organization. But as I pointed out, an important element of this is actually, person-centeredness is not just actually in nurse-patient interaction, nurse-family interaction. It's actually with colleagues, it's with teams, and also beginning to affect change within the culture in which people work. And that's why it's so good for the Nursing Now Challenge. It's worked really well. And as Matt said earlier, we've had quite a few nurse leaders actually who've taken this graduate certificate, and including Sharon, of course. And but they've they're using the methods in their own training work sometimes as well. Isn't that right, Matt?
Yeah, and the two organizations that we've completed contracts for, Western Trust and Western Urgent Care, have both said that they think that this training should not only be available to, but should be a required part of their continuing professional development for all staff from now on. They're so happy with the results that they want to make it available to everyone, not just to nursing and midwives, but also every other health profession, doctors and so on. We were working with Western Urgent Care, and we trained up all of their new and experienced nurses in telephone triage. And they want us to continue training all their new recruited nurses, but also we're working with them to develop a system of training based on the same ones we use with nurses for GPs. So everyone we've worked with so far has seen the value to the extent that they want to help us to expand to teaching more people within their organizations, including other professions. And yes, sometimes you'll find some employers think, I don't have the time. My staff don't have the time, especially when people are sick or they're off and we're short-staffed, and we're struggling to retain staff. Well, the evidence we've had sort of anecdotally from interviews and focus groups and the reflective discussions that we've had with the participants during the courses is this is a way of retaining staff. There are many, many nurses who we've worked with who said that they were thinking of quitting, and having done health action training, they're not only going to continue on in the job, but they're actually inspired to try to achieve to a higher level, to pursue their ambitions, to advocate on behalf of colleagues and patients and so on. So in terms of retention, there's been some, as I say, qualitative evidence, but substantial qualitative evidence that we're helping with that, and helping with workplace morale as well. Even just those discussions we have at the beginning of every session, the number of times people come in and say the techniques we've used have not only helped them to notice when something's wrong with a patient that maybe other people aren't noticing, maybe their nonverbal communications aren't being picked up on, to help to save lives in that way, to supporting colleagues through really challenging circumstances, to organizing major projects within their teams and so on, to just coping with the stress of the everyday life of being a nurse. I mean, we do things like breathing exercises, the relaxation exercises, some of which are originally from yoga or martial arts traditions. That would be part of your training as an actor as well, but they're increasingly acknowledged to be necessary to full functioning and well-being, physically, mentally, emotionally, and spiritually. You know, but we take that mindfulness and breathing exercise approach and then make it useful and applicable to, okay, how do I maintain that kind of mindfulness while acting compassionately with other people? I would say that every hour spent on the training is several hours saved from people going off sick or leaving the profession altogether or being too distressed.
We've had nurses that have said, you know, they were considering leaving, and as a result of this training, they were back on track. So I guess pretty radical, you know, it's pretty impressive. The other thing, there was a couple of things that Sue, you had questions from the last time, maybe would help us, and you had some queries, emails coming in from the last time.
Yeah, Pat, we're thinking the same. I was just about to say, I just wanted to point out, folks, and kind of recap or revisit from previous emails that we have received through those interested, you know, employers and employees. Firstly, again, just to remind you all that it is funded by Burdett through the Nursing Now Challenge, so it is free to you at point of delivery. All sessions are 3 hours long, okay? And Pat had already referred to that, and we don't want it much any longer than that. We've did that in the past, but they're all 3-hour sessions. They are accredited. And as I mentioned earlier, the Royal College of Nursing, and it's either a 12-hour CPD hours or the 36 hours, but they are accredited through the Royal College of Nursing and the CPD Standards Office. And on completion of the course, you will receive your certificate, and it will, the logos will be stated on the certificate that they're accredited by those professional bodies. And the other thing I want to highlight, some questions come through to me about doing the session, a weekly 3-hour session. And what we would advise to make you aware is it would be expected that alongside that 3-hour session that you would do a little bit of independent study. And that would be, you know, following up and reading, maybe watching a video we suggest, practicing, putting the new learning, of course, that you have gained into practice, actually applying it. When you return the following week, what we would normally do is, before anything, is we would go into a breakout room. You go in as a group into a breakout room and discuss the reading, discuss applications to practice, discuss the new learning, whatever that may be as a group. We then all come together and again, just share that. It's all totally reflective and it's all in a very safe, fun environment. But I just really want to get across that it is important to be aware that there's that little bit of an hour or two extra independent study that we would like you to follow up on reading. And obviously we put it down as like a homework each week.
Yeah,
but you know,
it's a good way to call it.
Yeah, it's a homework each week, but it's nothing huge or insurmountable.
No.
But something that's absolutely crucial, and we should get it across to employers groups. The only difficulty we've had at all, the only challenge has been the regularity of attendance. So everybody who's turned up has loved it, and everybody who's continued to do the course has had a great rewarding learning experience. And all the large majority of people we've worked with so far have said that they want to go on to do more training and to become trainers so far on the Nursing Now course. But people need to be able to attend every session every week. So I would ask employers, if you're thinking of recommending this to your employees, which is a very good idea, that to make sure that they have that same 3-hour slot free from their rota, from their schedule for the 4 weeks or the 12 weeks of whichever course you're doing. Because the only challenge we've had is, I'm sure you completely understand, and we completely understand, when people are short-staffed and they're under pressure and they don't have the resources, they're rotating nurses into shifts that clash with the teaching for very obviously good reasons. However, we would say the benefits that you will get from having an employee who's done the training will be much, much higher, including in terms of hours gained and lives saved and money saved, by allowing them to attend every session of the 3-hour core sessions that we have over the period of weeks that they're doing them. The 3 hours sacrosanct time slot plus
And
1 hour of independent work, please.
I second that as well, having come from a management background and having done these courses. Being a sister in an A&E department, I get it, that you need to cover your shift has to be covered safely, but it is no surprise that staff morale is very low. There's a lot of pressure out there. There's difficulties retaining staff. These are issues that are publicized everywhere at the minute. But what I can say personally is I actually didn't realize how stressed I was until I learned to ground and center myself and realize the importance of it. And when we talk about a positive effect after this, you really do need to come to the entirety of the sessions to really get it, to get what the teaching is. I've come away from, I'm 17 years qualified, and it was only since I did health action training that I actually sat back and thought, I'm getting so blustered with targets and the pressures, and my head sunk down, driving on all the time, that I haven't actually sat back and thought, what does nursing really come down to? And health action training just helps you to breathe and step back and reanalyze and refocus. And I find myself becoming more confident. And I didn't realize that I wasn't confident. I wouldn't have said I wasn't confident, but you have a different way of looking at things. And you definitely are refreshed going back into practice. So yes, I know it's very difficult to release staff. But if you have staff coming back feeling them positive emotions, it's going to have an impact on the practice. And it's going to have a positive impact on the practice. And that's so beneficial, and it really cannot be taught to any student or person other than the way that health action training delivers it. Health action, the difference with health action training is gives you the practical skills. It actually gives you the hands-on tools that are so easily applied from drama to nursing. They're so simply carried out and practice and to life for the person themselves beyond their work. So it's so invaluable, especially in the current time when it has been so stressful.
And we're looking for hubs to set up for our trainers in each of your countries, and so in your workplace. So for instance, if you run a hospital and you would like us to train some of the workers or all of the people who work in your hospital, we can end up basing ourselves there, if you like, and training up staff in our Train the Trainers program, particularly people who may be already involved in training. In fact, a significant majority of the nurses we've already worked with through the Nursing Now project have been trainers who are either teaching at university or college level, or are training, say, a regional body of community nurses in Nepal. I'm thinking of one particular participant we've had. And all of them have found the techniques useful enough that they've been using them within the first week of starting a course. The majority of people we've worked with are training other nurses, including at very senior levels. And in the second session of every course, we've been told that they found at least 2 or 3 valuable techniques that they've taught to their other people after the first session. But here's a question for you. Although we don't have any time left. Have we used up all the time? Oh no. Do we have? Are we finishing at 11? Or have Pat, Zini, your microphone's off?
I think we have some time to run over. Like we're
yeah.
not. So was it
11:30? Fantastic. Yes, we have half an hour. So here's a question for you. I want to hear from you guys, because we've delivered a 4-person monologue about the value of dialogical and experiential learning based on participants' own experiences and needs, and we haven't even started to. So everyone's very polite in not asking us any questions yet. Maybe we've been thorough in covering everything to do with health action training. But here's where we would like to hear from you in the chat box or the Q&A. What sorts of difficulties are you encountering at your workplace in terms of communication? You know, is it to do with communication with patients and family members? Is it teamwork? Is it are you short-staffed? Are you finding people are having to address new specialisms? And what, I mean, you tell us. Don't let me put ideas into your head or words into your mouth. Anyone, you know, everybody here, what kind of communication issues would you see as being a priority in your work environment? Is it breaking bad news? Is it dealing with people with dementia? Is it dealing with people with disabilities and so on? What kind of issues are occurring for you in your workplace in terms of either communication and person-centered care, or active compassion, as I like to call it, or resilience and staffing? There's Pat's put into the chat box, what challenge are you facing now in your workplace? And what are your priorities? Are people not struggling, which would be great? 15 attendees, and we can't turn cameras.
How about if the attendees, if you could put in the chat your area of work?
I see one of the attendees is Ephraim Century. Hello,
I've
Century.
seen Century. Hi, Century.
Yeah, Ephraim Century just did our course recently. He's a very busy working nurse. Century. Perhaps Century could put into the chat box or Q&A a question or a comment or an observation of his own about participating in the course. I mean, I know earlier Pat was saying about foreign language, or not foreign language, languages that is not English. We can have done some teaching in French, and we're hoping to train people up who are Spanish speakers, Mandarin speakers, Arabic speakers, and so on. We already have some participants who've said they would like to be trainers who speak those languages. But Century, I see your face has joined the panel. Do you want to turn on your camera and say hi? Century, can you hear me?
Hi, Century.
Hello. Yeah.
Hello.
Yeah. Can you hear me?
We can
We
hear
can't
you.
hear
Yes,
you.
yes.
Century. Yeah, we can hear
Yeah.
you. You can hear us?
Yes.
Just wondering if you wanted to say anything about your own experience of doing health action training.
Yes. I want to say it was a very good program, especially for nurses, and I encourage everyone to participate in it. But however, I have one major problem. It seems, since it's part of the nursing now program, national level nurses and association to know about it, because it seems most of nurses don't know about this program. For me, yeah. So I want us to advocate more, especially in low and middle income countries, so that a lot of nurses can gain from it, because it's a very nice program.
Okay, so you were wondering, you know, because it's a Nursing Now challenge and people only hearing about it through the Nursing Now challenge, how do you spread the information or the availability of the course to nurses nationally throughout your country?
Yes, so we can channel that through the individual nurses association within the country.
That's
for them to inform their members.
That's a very good question. Is there not a mechanism whereby you could ask your network to promote the Nursing Now challenge? Because Nursing Now membership is free, So I heard you saying earlier about how when you're dealing with nurses who are low income or live in low income countries, to make it available. The Nursing Now membership, as far as I know, is free. So you could ask people, you could promote the Nursing Now network and ask people to join on that basis. The other possibility is if you are in any way connected with any government or non-government health organizations in your country, that we have multiple contracts, and we've worked with different partners around the world, different organizations. So including sort of national sort of health ministries and so on. So perhaps you could start to advocate yourself as someone who has done health action training and thinks it's good training and everyone should be doing it. Maybe you could ask Nursing Now as well to help you coordinate communication with people who are in charge of funding inside and outside of your country. At the minute, we're working, this is a charitable project funded through the Burdett Trust. Well, it's not charitable, but it's funded through the Burdett Trust and Nursing Now. So we are delivering this free on that basis. But if you wanted us to come to your country and more closely with lots of nurses within your own national health sector, we have very reasonable prices, and we're willing to sort of negotiate different terms depending on the country of origin of the organization. And we do actually have private courses that we can charge individual practitioners to join. But as you say, some of those prices might be difficult for somebody in a low-income country or a low-income nurse. So, but we're willing to discuss all possibilities in terms of delivery and funding, including adjustment of fees, including helping people to find funding sources. So I would just say, Sentry, get in touch or put us in touch with anybody else in your country who who would think that this training sounds like a good idea, wants to deliver it. We can also partner with universities and other nursing training organizations and have done so. So whoever is training nurses in your country, get them to get in touch with us, and we can see what we can do to work out how to fund it.
Yeah. There's another question there as well. Sorry, I've just lost it. Is there any opportunity to work with you as an overseas?
So,
what you were saying there, Matt,
potentially the hubs we're talking about.
So what we're currently doing is we're doing it all from the UK via Zoom. And the great advantage of that is that we're working with nurses in Jordan and Mexico and Australia and the Philippines and Kenya and Uganda and Ghana and Nigeria and India and Nepal and Canada and the USA all at once, and Australia, which is wonderful. But it's difficult for people's time zones. So yes, we could travel to other countries. Basically, I think we're talking to Nursing Now. Over the next 3 years, we have to deliver 3 graduate certificate courses, plus 6 12-hour short courses, plus 1 train the trainers program each year over the next 3 years. And there's a possibility that if you could find an organization in your country that would be willing to sort of like fund travel costs or accommodation for us, that we might be able to get funding from within the Nursing Now project to go to a particular country if that was to become one of the regional hubs. So for instance, I see someone mentions in the chat box they would like to get us to come to Kenya to work with nurses. Well, we've been working with a couple of nurses from Kenya, particularly Zipporah Aregi, who seems to be pretty bit of a dynamo in the Kenyan nursing scene. She's kind of flying high very fast. She's been a fantastic participant in health action training, and she's found it very valuable. So she's already mentioned the possibility of coming to Kenya. So we would like to come to Kenya. And if Kenya was to be, say, one of the 6 regional hubs, we would probably be thinking one in Africa, one in Asia, one in Australasia, one in North America, one in South America, Europe, and so on, Middle East, that Kenya might be a base. So for instance, if whoever's asking that question was to sort of contact Zipporah Aregi, Cecilia Nungu. So if Cecilia was to get in touch with Zipporah and their local organizations, health ministries, hospitals, universities, and say, we would like to get these people to come to set up a health action training hub in Kenya, then that may be the case, and we would come there with help from Nursing Now.
and it might be, you know, just to give everybody a heads up, it's in addition to actually, you know, the Nursing Now project. It would actually be very specific to that organization. So this is why we'd need to talk to you individually.
Yep.
There's a question. There's a question here, or a comment from Rosemary, Josie, about, you know, staffing as a challenge. Yes, staffing is a challenge, but like we referred to, the health action training facilitates, helps with retention, helps with possibly, you know, I would even suggest as well recruitment to your organization, because if you have staff that actually are doing health action training, you know, it's quite a good idea to say this is what you offer as part of your support for staff as well. So yes, staffing is a challenge across the world, but we would see ourselves as actually one of the many groups that actually are working to retain the staff, the nursing workforce, but also support them and give longevity to address the retention and even recruitment issues as well. Unless you want to comment on that, Sue, do you? Yeah.
Yeah.
I just want to say thanks. Sorry to interrupt again, but we just had a post from Godfrey in Kenya, I think, Godfrey Sama, saying that they have this organization, Exacon, East Central and South African College of Nursing, that brings together people working in the area of nursing and midwifery with member states Botswana, Kenya, Lesotho, Malawi, Mauritius, Mozambique, Namibia, Rwanda, Seychelles, South Africa. So a whole bunch of different countries as a potential partner. So will Godfrey here email us and let's have a chat. Sorry, carry on, Sue.
No, I was just going to say there's lots coming through in the chat box, and a lot of interest in saying that we're certainly interested in joining up, coming on board and so forth. But I do want to say it's great talking about further collaboration and working alongside each other. But for the purpose of this, I would just like to remind folk the link is there. I've just shared it again. It has been shared by the by Nursing Now. That's the link in order to access the application to enroll for the courses, but also on that page you will see our details in order, email addresses and so forth, in order to get in touch with us directly if you have any further questions, so that touch base with each other.
Well, email addresses are on the course registration page.
Yeah, I think it's Pat's, you're down as course coordinator for the graduate certificate, and it's myself down for the short courses. So our details are there, and of course we can then share them as a team. But just
I'm sorry, go ahead. Sorry.
No, it was just to remind folk that the details, if they click on that link, that'll take them directly to the course page with Nursing Now.
I'd just like to come back to Rosemary. The retention of staff, really we have to sit back and question why are we not retaining staff, and majority of the reports is that it's burnout. They're not feeling that their worth and their work, and the constant pressure, and nobody's listening to them. What we have found through health action training, and I have personally found this as well, you do learn to care for yourself. You see your value in your work. That is when I say it's cut back to the simplicity. That's where health action training will bring you know, members of your team to, and they come there in a natural process. It's like a recognition for themselves. The other thing I would like to say with regards to burnout, what we have found through health action training is through the sympathetic presence. This is where person-centered care is really coming into effect. Instead of empathy, trying to take on all them emotions and trying to think that you can feel what that person is feeling. The difference is with sympathetic presence is that firstly, you're present and you are sympathetic, but you can still go on throughout the rest of your shift to the next task, the next task, the next task, and not carry the burden of the one before.
That's right. Part of the way.
Emotionally. Health
That's right.
action training, this is what it teaches your staff. This is what it gives your staff them skills to carry out and to practice. And if staff are feeling that way, they're going to stay in the workplace. So as much as it's hard to release staff, it's like pushing an uphill struggle constantly. Keep the staff on the floor. We need to cover the shift. And yes, you do. But for long-term retention of staff, this is where health action training really, really benefits the organization, the bigger picture. So I just wanted to say that it's really invaluable training for the person that is the nurse as well, and the organization.
That's good. Thank you, Sharon, for that.
Organization.
Like your direct experience of actually dealing with staffing issues, like even prior to the pandemic.
Yeah.
And we know that, but it's all hands to the pump, as I say. Like you need training and development and support to actually keep people, as Sharon said. So.
Well, a very large number of our participants have said that it was very noticeable at the beginning of a course that people are stressed out and frustrated. We often have in that opening debrief people who get to actually quite distressed, talking about all the difficulties they're facing with at work. And by the end of the course, you could just see the big smiles, and people are saying that they're happy to go back into work again. Many people have said, for the first time since I started as a nurse, I've remembered why I got into nursing in the first place, and this has made me, look forward to going to work.
Can I suggest something, please, if you don't mind? We've been talking quite a bit now for the last hour and a bit, and we have about 12 minutes left. Could we do a little breathing exercise or something?
Sure.
Yeah. I was going to say to you, Matt, I just noticed, did you notice my voice went a little there? And I forgot to do my voice exercises before today. So there you go. I have to practice what I preach.
Sure. Well, here, shall we just do some nice, simple, relaxing, centering and breathing exercises? Yes, complaints of staff burnout, Rosemary. Yes, we understand that there are a lot of people who have had a very tough couple of years now. If not a large majority of people, we've all had a bit of a hard time. So it's important to be able to remember that you can pay attention to what's happening right now. And right now, everything is fine. So we're going to do a little exercise in grounding and centering ourselves. And when I say fine, I don't mean you don't have any problems. I mean, right here, right now, in this moment, if you look around you, you're relatively safe. And that's a beautiful thing. So I want you to sort of feel your feet connecting to the floor. So your feet are flat on the floor and you feel them connecting to the floor. And through that floor, they're feeling connected to the earth. And you can feel your seat connected to your chair. So your bottom sitting on your chair. And you're aware of the fact that with your feet on the ground and your chair your seat on the chair, bottom on the seat, that you are connected to the earth below the floor, through that chair and through that floor. You are in the right place and at the right time on the planet, and the planet sustains you. It created you and it sustains you, keeps you going. And your feet are flat on the floor, your bottom is resting back on the chair, and your back is long and strong. And your front is soft and open. And your front is soft and open, not only physically, but also your heart is open to all of the joy and all of the sorrow in the world, all the feeling. And your head is floating up towards the sky like a balloon. And your jaw is relaxed. So your top teeth and your bottom teeth aren't touching. and your tongue is resting on the bottom of your mouth, behind your bottom teeth. And you're letting your breath fall into your center of gravity, which is 2 inches below your belly button. And when you breathe into your center, 2 inches below your belly button. And when you breathe out, the air comes out of that same center. You can imagine the lungs like a glass, and you fill it with water. It fills from the bottom first. Then when you tip the glass over, the bottom of the glass is the first to be emptied. So similarly, when you breathe in, the bottom of your torso, 2 inches below your belly button, is the first to fill with air as you breathe in using your diaphragm. And it's also the first to release the air as you breathe out. But this happens naturally. So you're just noticing your breathing, feeling your feet connected to the floor, you're feeling your bottom connected to the chair, your back floating up long and strong, your head floating up towards the sky, front soft and open, jaw relaxed. And if your eyes are closed, you open them and you look at whatever you can see. And you listen to whatever you can hear. And if your thoughts are distracting, that's fine. Just acknowledge them. And as you breathe out, let them float away. But also you might want to return to the phrase, I'm me, I'm here, and I'm fine. I'm me, I'm here, and I'm fine. So this approach is a combination of Zen Buddhist techniques that I learned from Arowana Hayashi of the Social Presencing Theatre, and an approach to working as a director and facilitator with both community members and professional actors by Alan Lydiard in Newcastle, England, who had this approach of grounding yourself while saying, I'm me and I'm here and I'm fine, and some other yoga techniques. So we're now going to do a breathing exercise from yoga. This is the first breathing technique I was ever taught. I was taught it by a nurse when I was 18 years old. She was having panic attacks working in the emergency department, particularly when there were car accidents involving children, which she found very distressing. She would say that if she did 2 minutes of this breathing exercise, she was able to get straight back to work, having slowed down her heart rate and calmed her mind. And I've since then also been taught the same breathing exercise by teachers of transcendental meditation and yoga teachers and voice teachers and so on. So this is a good one. It's also the first breathing exercise discussed in Breath, The New Science of a Lost Art, the book by James Nestor. And James Nestor also has a website that I would highly recommend. And that book has lots of different breathing exercises, including the scientific evidence to show what the different specific advantages of each breathing exercise are and how we need to get back to consciously breathing in order to keep ourselves fully alive. Anyway, we'll do this simple breathing exercise. You take your right hand. It's called alternate nostril breathing or Nadi Shodhana. And you block your right nostril with your right thumb and breathe out through your left nostril. Then you breathe in. And then you close your left nostril with your 2 middle fingers of your right hand and open your thumb and breathe out. Breathe in. Close your thumb, open your fingers and breathe out. Breathe in. Close your fingers, open your thumb and breathe out. And breathe in. Close the fingers, thumb, open the fingers and breathe out. Last time, breathe in. Close the fingers, open the thumb and breathe out. Breathe in. Close the thumb, open the fingers and breathe out. And then one more breathing exercise in the book, Breath, The New Science of a Lost Art. Apparently, this is the best breathing for your metabolism and your general health and well-being. It's called Coherence Breathing. And apparently coherent breathing is so much the optimal breathing for your metabolism and your well-being and state of mind and physical and mental and for spiritual health, that you should do this kind of breathing as often as possible for as long as possible. The more you do this next coherent breathing, the healthier and happier you will be. And it's very simple. You breathe in for 6 seconds and out for 6 seconds in one continuous flow through the nose. So we'll do some of that together. So breathing out through the nose, and I'll do the counting. Breathe in, 2, 3, 4, 5, 6. Breathing out through the nose, 2, 3, 4, 5, 6. Breathing in through the nose, 2, 3, 4, 5, 6. And breathing out through the nose, 2, 3, 4, 5, 6. And last one, breathing in through the nose, 2, 3, 4, 5, 6, and out through the nose, 2, 3, 4, 5, 6. So that first exercise we did, the grounding exercise, from a sort of Buddhist tradition, helps you to become immediately more present. When you're looking at what you can see and listening to what you can hear, you're practicing those same skills of looking at and listening to the people that you're working with, as well as the world, and becoming more present in the beautiful here and now. And with the coherent and with the alternate nostril breathing, you calm your heart rate, calm your mind, center yourself. It's also good, stimulates the vagus nerve and the parasympathetic nervous system, so it triggers that rest and digest response. So it's even good for keeping you regular. And then the coherent breathing, in for 6 seconds and out for 6 seconds, sustains your health and well-being on a daily basis. And we would do centering and breathing exercises like that at the beginning of every session, and then we would move on to voice exercises, as Pat was referring to from actor training, because a lot of nurses ended up damaging their voice. Anyone who communicates verbally for a living needs to support and work on their voice health. And then we look at attention towards other people and intention, what we're doing and why we're doing it, what people want, what people really mean from a situation, because the subtext is everything. And what someone says, as we all know from and one of our exercises, if somebody says, "How are you?" and somebody else says, "I'm fine," what are they really telling you? And what they're really telling you is what they're doing. If I say, "How are you?" and Sharon ignores me, so Sharon is ignoring me. Sharon, shall we demonstrate? I'll do a "How are you?" and Sharon's going to ignore me with "I'm fine." And "How are you?" I will be doing something to her. I will be interrogating her. So I'm interrogating her and she's ignoring me. How are you, Sharon?
Fine.
Okay. On the other hand, I could be trying to befriend her. I want to charm her. I want her to like me. I want her to, be my new playmate. And she is going to make fun of me when she says I'm fine, right? So I am befriending her and she is mocking me. How are you?
I'm fine.
As you can see from those two examples, there's a big difference between what the words "how are you" and "I'm fine" mean, depending on what you're doing, why you're doing it, what's going on around you. That is the secret of communication. And that is what actors learn. And that is what health action training teaches. What are people really wanting? What do people really mean? How are people really feeling? and how you can learn how to pay attention to that in a way, then you can practice getting better at doing the things you need to do and want to do, and helping each other do the same. So I think we've come to the end of our time.
Yes.
And we would love to hear more from you. Feel free, please, to contact us via those email addresses. We are more than happy to talk to everybody and anybody about any new opportunities for health action training. And we hope to see some of you on the courses that are coming up. As Sue said, the next graduate certificate is starting on 27th of June for the graduate certificate. And the next short course on coping with crisis, which focuses on health and well-being, starts on, that's already started.
21st of July.
21st of July.
Yeah.
Yeah, and isn't there anyway, get in touch with us and sign up for one of those courses.
Okay,
Thanks a million, Nursing Now.
Thank you all.
Thank you.
Good colleagues for
Take
this morning.
care.
Bye-bye.
Bye. Bye.